Are you saying they're vulnerable, that decision specifically to close those ERs in Niagara area, that they could be challenged in court because there is no documentation and supporting evidence?
They created themselves a legal exposure by being sneaky in adopting a bylaw which did not comply with the legislation. And they'll have to live with the consequences. You know, I think that there's two reasons why these board meetings have to be made public. And the first reason is that, and the minister at the time made it very clear, the decisions have to be responsive to local needs. That's the whole purpose for creating the LHINs. And if you don't allow the community to get engaged and be informed and know what's happening, the deliberations that are being done, you're not being responsive to local need. The second reason is to keep everybody honest. These LHINs are dealing with $2.5 billion of public funds. We don't want any hanky-panky. We don't want any cloak and dagger decision-making. So I think there's strong public policy to support the legislation.
Pensez que les décisions qui ont été prises devraient être revues à la lumière du processus qui a manqué de transparence.
Le numéro 2 qui a été adopté par ce RLIS, c'est que c'est un règlement qui est illégal. Un règlement qui est adopté doit respecter sa loi habilitante. Le risque dans la situation qui nous occupe en ce moment, c'est que le règlement qui a été passé met en question toutes les rencontres qui ont lieu à huis clos. Et puis il y a un risque au point de vue juridique qu'il y a eu un excès de juridiction, un excès de compétences de la part de ce RLIS. Et puis ils vont devoir vivre avec les conséquences. À savoir si les décisions qui ont été prises devraient être revues ou changées, modifiées. Il appartient au gouvernement et au RLIS de décider quoi faire à ce stade-ci avec les données et nos conclusions.
Two other fairly major announcements which could easily be construed as an attempt to muddy the waters, deflect from the strength of your report today. It would seem the spinning goes on.
Is this?
Gouge report on the Cornwall inquiry, which were both announced after this today.
I guess they figured you guys would all be showing up, so might as well have announcements to make. I don't make, to me, what's important to me is that I gave them full notice. I gave everybody notice. I have no further comments on that point.
Talk a little bit about the attitude you encountered. I mean, these organizations are pretty new for bureaucracies to be acting defensive and recalcitrant in a matter of a couple of years.
No, absolutely. You know, I was floored, quite frankly. I think the LHIN should have eaten a bit of humble pie and said, listen, we're new. We want to make sure that we're responsive to the findings of an officer of parliament. And when you look at the 3 recommendations we made, they're not all that difficult to comply with, right? Number 1, you know, inform us about your process for engaging the public. You know, we told them to get rid of your bylaw that allows you to have sneaky meetings out of the view of the public. And we asked the Ministry of Health to adopt guidelines as to what public engagement means. I mean, that's not these are not very intrusive recommendations. And, you know, we receive in response a very lengthy legalistic response. You know, part 1, errors and omissions. You would think that this was a, you know, property law issue. I mean, it's surprising to me that such a simple set of recommendations would be dealt this way. The other thing that surprised me is the kind of lip service paid to public engagement. I mean, there's a couple comments that struck me. One was, well, you know, let's not get too fussy about this. We do public engagement at the 10,000-foot level. You know, this is a journey, not an event. And to me, it sounded more like a trip to Club Med than an exercise in democracy. You got to take it seriously. People are not stupid.
LHINs trying to feel their way, I guess, still trying to figure out what decisions they're supposed to be making. You've got hospital boards making decisions. You have all of these different reviews talking about closing these ERs, amalgamating the Niagara Health Region. And you also have a public who's been trying to engage for a long time. What's happening here? Is it just, does no one know what they're doing? Is the direction just coming from the top, from the minister?
You know, I think the raison d'être for the LHINs is defendable. That being said, you know, that's an issue of broad public policy. And that's why we elect representatives, to adopt broad public policy. My job is to look at the execution of that policy, to determine, is it fair, is it just, is it reasonable, is it right, wrong, or illegal. So it's really, the broader issue that you've raised is really one that belongs to members of the Legislative Assembly, and that's why we elect them to decide these broad public policy issues.
Are you concerned that some of the decisions that were made in these secret meetings were not just motivations to make it easier for the board, but someone else might have financially was rewarded as a result of these decisions made?
You know, I don't think so. I don't think that there was an intent here. Let's go defeat the legislation. Let's do something illegal. I think part of the problem has to rest with the Ministry of Health. When they released the legislation, they had an option. And that option was to provide clarity through regulation about what public engagement was. And they washed their hands of it. They said, well, let's let local community define public engagement. So they went ahead. They took the lead on it. And then it unraveled and got out of control. And then what happened is these LHINs realized that the legislation was too confining. They wanted an education exception, which is fine. But what they should have done is lobbied the ministry for regulation, a legislative amendment. But instead they went ahead, forged ahead, adopted their own bylaw. And then when they succeeded in doing that, the next step was to use the education provision to cram in submission. And that's when it became, I think, particularly serious. So we're not just talking about a bylaw which hypothetically, legally is illegal, but one which was used, in fact, to defeat the objectives of the legislation. And that, I think, is the most egregious part of it.
The secret meetings, how well were they documented?
The secret meetings, I mean, for us, it took a lot of prying. It was not easy. We had to gather who was at the meeting, and then make a separate request for documents that was distributed, obtain PowerPoints. The secret meetings were not very well documented. And as I mentioned in my opening, one LHIN created this education exception, and then it just crept across the board. And out of the 14 LHINs, I believe 8 of them on their website indicate that they've created this education provision exception by law, and 6 of them do not. So not only are the meetings kept secret, but the premise for holding the meetings would not be known to the communities. So it's a double.
The other 6 have them, they just don't admit it.
That's right.
Yeah. And one final question: who was the board member who did his public engagement on the golf course?
I don't have the name.
Was it a private golf course or a public golf course? Do we know?
I wouldn't know, but we can look into that for you. Okay, thanks very much.